Thank you. A few years ago, a man named Michael walked into my psychotherapy practice and took a seat on my couch. As he began to tell me a little bit about his life and his problems, he shared that he was in a great amount of emotional pain. Michael described being smothered by an inner critic whose judgments punished him every day. He walked around in his life with anxiety and despair, not really knowing if the negative ideas he had about himself from inside of himself were true. He could hardly remember a time in his life without it, and had grown hopeless about having a different kind of experience. Michael had seen several reputable therapists over the course of many years, and although he had achieved some level of relief from this, it didn't go far enough. He still felt like his life was choked off and constricted. He couldn't pursue his interests in the world because, to his critic, his interests would never be good enough interests. And he would never be enough to be worthy of connecting to other people in a way that was meaningful. Because of his long treatment history, I decided to approach his case creatively, and that's where the martial arts come into play. 10 years ago, my colleague Bruce Gregory and I began our journey into the world of martial arts. As our interest grew and deepened, we began to wonder whether there were applications of the martial arts in our clinical practices. We wondered, how can the mat and our work on the mat begin to inform the couch and our work with people on the couch? Even the descriptive language that people use when they walked into our offices hinted at that possibility. People would come in and they might talk about wrestling or grappling with an addiction or some other self-destructive behavior. Or they might talk about being battered or beaten up by their own feelings or the emotional reactivity of a partner, or by unhealthy parts of the self, like Michael. Other people might come in and talk about being smothered by their anxiety or the force of their depression. So in time, Bruce and I decided to think in terms of trying to mine the martial arts for their potential clinical applications to these kinds of problems and many others. We began to look for the equivalent of a mixed martial art for psychotherapy. After all, the martial arts have, for hundreds, if not thousands of years, tested and explored with great precision how to deal with forces that are coming at us from different angles and how to deal with different kinds of strikes. Applying that body of knowledge to the forces coming at us from inside of us and to the verbal strikes that might occur in bad moments and even the best relationships seemed obvious. Some of the ideas that grabbed our attention right from the beginning are embedded in all of the martial arts. These are ideas of preparation and preparation for different lines of attack and different kinds of strikes. Ideas of structure, base, position, and center line. And ideas of space and an awareness of space and how to create and utilize space. With these ideas and many others, we were able to develop the psychological, some of the psychological blocks, counters, and disarms that our patients could begin to utilize to generate new kinds of experiences inside. And I brought some friends along to bring this to life. This is Sifu Massa and Sifu Richard from the Way of No Way Martial Arts School. And today, Richard is the symptom in this representation of a part of our inner worlds. Symptoms can take our backs and push us around in ways that are both conscious and unconscious, dragging down the quality of our life. Some people don't know they have symptoms or don't appreciate the depth or the magnitude of them or the impact on their life because they can't see them. And they can spend their entire life thinking that the problem or symptom's only out there or in the other person. Michael was smothered by his symptom, buried underneath it. Sometimes people on the bottom can feel hopeless inside. I don't have the capacity, even if I tried, to get out from under this problem. While others have resigned, this is the way my life and the world has always been and always will be. Michael was dealing with feeling unworthy. I'm not important enough to struggle and fight for. Some people cling to their problems and symptoms, too afraid to face the world without them in an unfamiliar way. How many of us have, at times in our lives, been in one of these positions relative to our psychological symptoms, our psychological problems? In time, people can learn to create space from their symptoms, sustain space from their symptoms, and transition into a better position psychologically relative to their symptoms. People can learn to maintain their base inside when their symptoms shake them, and prevent being taken down when their symptoms flare up. Of course, this isn't literal, but a mindset that can be integrated, not to defeat or destroy our symptoms, but to defeat the unhealthy hold they can have on us, so that we can, inside, sit across from them and learn what they have to teach us about our wounds and injuries, our blind spots and growth edges, and our capacities. And in this way, our symptoms become training partners in the evolution of our consciousness. Thank you. The next step has been to begin to organize groups for some of my psychotherapy patients, many of whom don't have any prior martial arts experience, so they can learn some basic techniques and feel the physical expression of things like preparation, base, counters, and disarms. It's my belief that the physical practice of martial arts can connect us to deep programs in the blueprints of our psyche, programs that support us in activating and decrease the experience of being passive in both our outer and our inner worlds. And these groups are testing that hypothesis. And as for Michael, well, I asked him if he knew anything about wrestling or grappling or jiu-jitsu, and he said not very much. In time, we talked about position and the position that he's in relative to his critic. I showed him pictures of wrestlers smothering their opponents in competition, and he connected with the ways that he felt like that inside, to the ways that he was being submitted every day. Together, we developed moves he can make to move into a better position psychologically relative to his critic, and counters for when his critic's judgments flared up. To his credit, he practiced, trained, and rehearsed just like a committed martial artist would train a series of new moves on the mat. And as he did that, something very, very beautiful began to happen. He began to experience more space inside of him from this part than he had ever known before. And in that space, he began to engage the world in a new way. He began to pursue interests, connect to more people, and even developed a relationship that he's still in to this day. Many critically important experiences happen in psychotherapy offices on couches every single day. Many, many, many years ago, my life was saved on a couch like that, allowing me to be here today talking to you. My goal is not to trade in the couch for a mat, but to turn the consulting room into a creative laboratory that's always seeking to grow and evolve by way of refreshing new ideas. And the martial arts have proven to be a deep well of wisdom to support that goal. Thank you.